Once a patient is diagnosed with Parkinson's disease, the next question comes down to is when to initiate treatment and what to initiate treatment with. At the present time, we do not have any medication that can cure Parkinson's disease or any medication that can, without doubt, slow the disease progression. So we often use medications to help with the symptoms. Your physician and you may decide on when to actually initiate therapy. It may depend on certain physicians who may initiate therapy as soon as the diagnosis is made. Some physicians may actually wait till the symptoms actually become bothersome for the patient. Finally, some physicians may actually wait till the symptoms are affecting the patients on their day-to-day life. But once an assessment is made to initiate treatment, there are multiple different medications available with which to initiate treatment. And again, this will depend on how bad your symptoms are, what other symptoms in addition to Parkinson's disease you are having, to what medication that a physician may choose to initiate treatment. There are multiple groups of medications available to initiate treatment. Usually, if someone has very mild symptoms, a physician may look at a group of drugs called Mao-B inhibitors. These drugs include medications such as selegiline, also known as Eldepril, or rasagiline, also known as Azilect. Now, this drug has very mild symptomatic benefit, but also has very few side effects. One of the drawbacks of Mao-B inhibitors is that there are certain other medications, such as some narcotic pain medications, that cannot be used with Mao-B inhibitors. So if you decide to initiate Mao-B inhibitors, you need to make sure you are not taking or will not take any of these restricted medications. The next group of drugs are called dopamine agonists. Dopamine agonists have a slightly more efficacy than Mao-B inhibitors. The dopamine agonists that are currently available include ropinirole or Requip, pramipexole, also called Mirapex, and there's a once-a-day ropinirole called Requip XL. These drugs are usually started at very low doses, and over a period of weeks, the doses gradually increased. So when you initiate therapy, you will not notice an improvement in symptoms right away. It will take a few weeks for the improvement to occur. Usually, dopamine agonists may improve your symptoms by 30 to 50%. Again, dopamine agonists have more side effects compared to Mao-B inhibitors, and these common side effects may include nausea, sleepiness or somnolence, or swelling of the feet. Rarely patients could have confusion or hallucinations. One very rare side effect of dopamine agonist is called impulse disorders, in which patients get impulsive and do certain activities such as they may start gambling or shopping. So if you notice any changes in your personality, any impulsive behavior that begins, you need to discuss with your physician that your dose may need to be adjusted or even discontinued. The next group of drug is Levodopa. Levodopa by far is the most efficacious treatment for Parkinson's disease. It has been available for over 40 years. One of the concerns with Levodopa is that over time, usually over years, patients may develop what we call motor fluctuations and dyskinesias. By motor fluctuations, we mean that the patients may have times when the medications work and times when the medications may not work. In addition, patients may develop these involuntary dyskinetic movements. Usually, Levodopa will help the symptoms anywhere from 50 to 100%, so there will be a marked improvement in symptoms with Levodopa, except the tremor at times may not respond to Levodopa. Rarely, your patient may initiate amantadine, which has mild symptomatic benefit, and it's an antiviral drug. Rarely, especially in young patients, anticholinergic group of drugs may be started. Anticholinergic drugs, unfortunately, have more side effects, and the only symptom they consistently help is tremors. So once you have seen your physician, once he decides what medication you may need, depending on the severity of your symptoms, your age, and how well you may initiate therapy, these are the group of drugs that will be used. As I mentioned earlier, usually with mild symptoms, a physician may initiate an Mao-B inhibitor. As the symptoms get worse, in a younger patient, usually younger than 70 years of age, a physician may initiate dopamine agonists, and an older patient, older than 70 years, a physician may initiate levodopa. As the disease progresses, patients often end up on combination therapy with levodopa, dopamine agonists, Mao-B inhibitors, and other group of drugs.